Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com. On today's show, I brought a patient in. She's a female that's doing hormone replacement with us. And I really want to focus on today's show on the importance of hormones for females and males and dispel some misconceptions that are out there. So we're going to cut to break and we'll be right back.
Ready?
Right.
Okay, here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is our website. All the radio shows are on there and a lot of other cool information. But I'm here today with a patient. She's a hormone replacement patient, and she actually had to get on hormone replacement early in her life because she's a breast cancer survivor. And when you have breast cancer and the whole chemo process tends to mess up your hormone system. Hey, Laura, how you doing?
Good. How are you?
Good. So Laura was diagnosed with breast cancer at what age?
40.
40 years old, and what stinks about cancer is you're probably in the best shape of your life. You were training for an Ironman, and you had just done an Ironman. Now, just so everyone's clear on what an Ironman is, what is an Ironman?
It is biking, swimming, and running. And you swim 2 miles, and then you.
I can't even get across the pool.
Yeah, so you swim, and then you bike 112, and then you run a marathon in one day.
So you were in pretty good shape, I would say.
Yes.
And you were training for that, and you had just completed one, I think, and then you were getting ready to train for another one when you got your diagnosis.
Correct.
And obviously, with that, there's surgeries and chemotherapy. That's quite a process. I mean,
It was a lot of surgeries, a lot of MRIs and CAT scans, a lot of testing, a lot.
And a lot of females, once you get through the chemotherapy, that throws you through menopause.
Yes, I went straight into menopause with the chemotherapy. Correct.
And unfortunately, once that happens, and we have a couple other patients that have been through the same process. Once you get through the chemotherapy and you're through menopause, basically what menopause means is you're ahormonal at the end of this. You're left with no testosterone, no progesterone, no estrogen, and that's not a good place to be.
Agreed.
So
100%.
So you came to us shortly afterwards, and we started hormone therapy fairly quickly. And if you're sitting here listening and you're a female, what are the signs that you are hormone deficient? And some of the key things you would look for is hot flashes or night sweats, PMS, weight gain, mood swings, insomnia, depression, fatigue, endometriosis, low libido, dryness, and foggy memory. These are the big things that women have to watch out for. And if you're suffering with any of these, and people become hormone deficient even earlier on in life at this point. There's a lot of females that come in even in their 30s that are suffering with these things that would benefit from hormone replacement therapy. So it's very important to jump on these right away. Now, you started therapy, and I think kind of a cool story is you completed another Ironman when you're still going through chemo.
Correct. I had one more treatment to go, and I had decided when I actually first got diagnosed with the breast cancer that I would do the Ironman, and I was supposed to be done, but it was extended. So yes, my last one, and it was really tough, but I did it.
So she actually completed an Ironman on chemo.
Yes.
Not advisable, but definitely.
I did it. Yes.
So what have you noticed? So you've been on hormones, and you've done. You do testosterone pellets, and you've done gel also, I think.
Yes, I've done both of them. I actually like the cream right now.
Okay.
I've got, oh gosh, my energy. I feel like I'm back. I'm back to where I was pre all of the chemo, all of it. The energy level, everything is back. I feel normal again. Finally, yeah. Yes.
And unfortunately for what happens to women too, your situation, obviously you're thrown into menopause real quickly, but what happens to females, guys' testosterone decline is usually 3 to 5% per year. So what happens with guys is, late 20s, early 30s, they start to go down this slope. And, and usually the guys don't really notice the big signs of it, or, they usually don't come to us until their late 30s or 40s because it's been a slow decline. Females, we always know females are more complicated. But females, what happens with them is when they get this premenopause or perimenopause, it's a pretty steep drop off. Usually, what will happen is, and it happens to them in a couple years instead of 5 or 10 years for guys. Females fall off that cliff, And and as we talked about, what are the signs? Those hot flashes, night sweats, weight gain, mood swings, depression, fatigue, foggy memory. When you start suffering with these as a female, it's very important that you get your blood checked and see what your levels are. Sleep patterns. If you don't have any progesterone, you're not going to sleep properly. And there's a lot of females out there, their sleep's terrible, and it can be easily fixed. Now, one other thing I'll say, and I see clinically, is if I had to pick, I think it's more important for females to be on hormone replacement than it is for males. And I think it's very important for both. But what happens in females is when females stop producing estrogen, that's usually when you're getting your hot flashes and stuff, your estrogen receptors actually shut down. So, and what that means is the longer a female waits to start hormone replacement therapy, the less effective it will be. So you can have a guy come in who's 7 years old, never been on testosterone or any type of hormone replacement therapy. We get them on a program, and 8 weeks later, they're a new man. Females don't work that way. So if you're a female listening, or if you're a spouse of a female and she's suffering with these things, the sooner they get on hormone replacement, the better, because you really want to avoid that downregulation of the receptors, in particular the estrogen receptors. And another thing that happens, a lot of females avoid hormone replacement therapy for whatever reason, and I think number one's probably because of a lot of guys do it because all the commercials you see on TV. We can thank the testosterone gels, which are no good, but those commercials are on TV all the time, so that made testosterone cool again, I would say. But you don't really see those commercials for females. And the other thing that's unfortunate for females is a lot of the products that are out there for females are not bioidentical. And what is a bioidentical medication? So the easiest way to think of a bioidentical hormone, for males or for females, is these are hormones that are identical to what your body produces. So kind of think of it as when your body quits producing a hormone, this bioidentical is like a spare key. It fits exactly into the receptors that you have, and the body, doesn't know the difference between that and something synthetic. The problem is bioidenticals, which are naturally occurring, are not patentable. So if something's not patentable, there's no money in it. And when there's no money in it, you won't see commercials for it, and you won't see drug reps pushing it at your doctor's office. So unfortunately, in particular with females, there's lots of non-bioidentical products. Well, these non-bioidenticals, your body can tell. And these non-bioidenticals are known to cause cancer and lots of bad side effects. And the media has reported a lot of this stuff, so a lot of females don't realize there's a bioidentical option. So a lot of females just say, you know what? I know I'd probably feel better if I did hormones, but there's really no safe options out there, so I'm just going to have to take it and deal with these hot flashes and deal with the weight gain and deal with my skin drying out and my hair falling out and all the bad side effects, because that's better than getting cancer from taking these synthetic drugs. But that's just not the case. There's lots of good bioidenticals for females too that are safe and will prevent cancer and prevent heart disease. And I want to talk a little bit about, we're going to cut the break real quick. We're going to come back and we're going to talk about what some of the non-bioidenticals are. So if your wife or if you're listening or taking some type of estrogen or progesterone, I'm going to go through the ones you should not be taking because these are non-bioidentical and can have some very serious health effects. So we are going to cut the break. This is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com.
I can talk about the hot flashes too, because I know a lot of women think that it's like, okay, like that's a rite of passage, and it's not, like they're gone now. Like, for the most part, 95% gone.
Got it. All right.
Okay.
Sounded good. Ready?
Ready. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com, and we're here today talking about female and male hormones. We're kind of focusing on females today because there's a lot of females out there that are suffering through premenopause and perimenopause or even postmenopause. And you don't have to. Just like males, female hormone replacement therapy is very safe. It's going to help you live longer and feel better. And you were talking a little bit on break about the dreaded hot flashes.
Dreaded hot flashes. As of being 40 years old and going through all of this and going through menopause at such an early age, I thought that, of course, the chemotherapy, I was stripped of everything, and it was just, I had to accept it. And when I tell you, like, I just dealt with it. I would burst into flames literally like every night, sweat profusely. It would wake me up all the time. And this talking with other women, it was just kind of like, this is what we have to deal with. oh well, just kind of going on, and it was a joke. It's almost like a joke with it, that's what we have to do. But I got to tell you that with doing all of this and the testosterone, I don't have that. I would say 95% of my hot flashes are gone. And I really just thought I had to live with it. I remember being at dinner one time in Orlando. It was a cruise, and I was dressed up in a beautiful dress, and I had my kids with me, and they looked over at me, and I was sweating, absolutely sweating. It was dinner, and I had a nice dress. It was not hot out at all. But just to have that gone has been terrific.
That's awesome. That's awesome. And a lot of females suffer with this, and they don't, as we're talking about, they're afraid to go get on hormones because there's a lot of bad hormones out there. You know, this hot flashes you're pertaining to, that's because of lack of estrogen. And estrogen's also essential for bone health, joint health, hair, and skin. That's why females, as they get older, become osteoporotic. If you don't end up taking estrogen, once you get through menopause, you will become osteoporotic. It's not if, it's when. And the same thing will happen with your joints, even the cartilage. There's estrogen receptors in the cartilage, and this lack of estrogen just causes your joints to wear out, your bones to wear out, and just it basically ages you. So it's very important for females to be on estrogen. But as we were talking about on the last session, you got to make sure it's a bioidentical, and that means it's identical to what your body produces. Your body doesn't know the difference. It's safe, it's effective, and it works. It's a spare key. But there's lots of, unfortunately, because anything that's bioidentical is not patentable. So the way drug companies work is, they want to make money. So we can't make money with this. So let's take that molecule of estrogen and we'll add one little ester here, or a carbon molecule there, and we'll call it super estrogen, and we'll patent it, and we have a patent for 15 years, and we'll make a lot of money. That's how hormones, and that's how all drugs work. So, in a couple, I want to talk real quickly about some of the hormones that you should not be taking. And unfortunately, a lot of doctors, in particular doctors who don't specialize in anti-aging, usually what they'll do is they'll prescribe what the rep comes in there, and they tell them this is what the new super one is. And, nothing against primary care. I mean, primary care physicians have to be know a little bit about everything, but they can't be experts in everything, obviously. That's why, if you have a heart problem, you go to a heart doctor, or a kidney problem, you go to a kidney doctor. The same thing is with hormones. If you're really serious about doing hormones right, you need to go to someone who's been trained in hormones. And in a Buckeye, we're diplomate trained in anti-aging. This is what we do. So a couple of the hormones that females should not be on, and a lot of females take, and number one is Premarin. Premarin is actually from horse urine, and it is a non-bioidentical. It's patented, and a lot of females take it, but this Premarin that literally comes from a mare's urine, that's a horse, causes cancer. It's known to cause cancer, but it's still prescribed. There's other stuff out there. There's Senestin, that's another non-bioidentical. There's Estratabs. These are estrone and equilin. These are both also non-bioidenticals. There's lots of S-trace out there. There's Ogen out there. These are medications that are out there. They're estrogens that would help with hot flashes, and they probably do help with the hot flashes, but they're non-bioidentical and could lead to lots of other different problems. So very important if you're getting estrogen to go see someone who knows what they're doing. What you got to keep in mind as a female, you guys have three estrogens. You have E1, E2, and E3. So there's three forms of estrogen that the body has and needs. E1's the bad one. That's what causes cancer, causes strokes. That's why birth control pills are unsafe and unhealthy, because that's E1 basically. But then there's E2 and E3, and these are anti-cancer, anti-aging. So at Buckeye, if you come in and, after we do blood test on you, determine that you would benefit from estrogen therapy, we only prescribe E2 and E3. That's the anti-cancer, anti-aging forms of estrogen. These are safe, effective, and will help you feel better and live longer. Now, kind of a unique story about this, though, is if you're taking any type of pill for estrogen, I don't care what it is, if your doctor's prescribed you an oral form of estrogen, when you take E1, E2, or E3 orally, that means you take it via a pill, a percentage of it converts back to E1. So even if you're taking E2 or E3 as a pill, as a female, realize this is converting to E1. So females should never take estrogen in pill form. It's a terrible way to get it. It's going to convert to that E1, and it's just not good. It's just like guys. if you're a guy and you're taking testosterone as a pill, don't do it. For you to absorb testosterone orally, has to be methylated. When it's methylated, it has to double pass the liver. It's very unsafe. It's going to cause high liver functions, can lead to cirrhosis, lots of bad stuff. So testosterone or estrogen should never be taken orally. So for females, the best way to get estrogen is to put it on as a gel or cream. The reason that's so effective is when you put that on as a gel or cream, the aromatase enzyme actually lies in the female skin also, so it aromatizes and converts into some natural estrogen too. So at Buckeye, we only use estrogen as a cream form. Now, testosterone for females, there's two different ways you can take it. You can do it as a pellet, or you can do it as a gel. I think you've done both.
Correct. Yeah.
And honestly, there's no cookie cutter on this. A lot of females like pellets, a lot like the gel.
Yeah, I would say I've done the pellets. I think I like the gel. It's just part of my routine, or the cream every morning. Mm-hmm. Yep.
So, but and that's 50-50. So at Buckeye, obviously every female when they come in, we treat everyone as an individual. There's no cookie cutter. So a lot of times we'll start someone on the pellet. If they don't like it, we'll switch them to cream, or we'll start like you started with the pellet and switch to cream. Yes. And we have some people that start as cream and they switch to gel. Usually what I would say is if there's a risk of cross contamination. If you're female and have a young child and you're worried about cross-contamination because you can't get cross-contamination with testosterone, start with a pellet. That's the most logical. If you don't have a cross-contamination risk at all, or then the gel might be a better option. But kind of circling back to what we talked about, the main thing here is if you're getting hormones at your doctor, be sure to ask, is it bioidentical? And if they don't know what you're talking about or act like or say there's no difference, there's a huge difference, then I would strongly recommend you get to someone who only prescribes bioidenticals like we do at Buckeye. So we are going to cut to break here with Laura, and we'll be right back.
I work with my oncologist and I go with blood tests. People pray out there because they're going to go to their oncologist and say, no.
Mm-hmm. Yep.
You got about 10 more minutes.
Got it.
Ready?
Right. Hey, this is Dr. Buzz with Buckeye Physical Medicine Rehab. That's BuckeyePMR.com. I'm here with Laura today, and we are talking, she's a female, she's a breast cancer survivor, and we're talking about hormone replacements and how it's helped her out. And she brought up a really important point on break. If you're a female listening to this, and you're a cancer survivor, but you've been through chemo and it's put you through menopause, I know a lot of you are probably thinking, well, I'm going to go talk to my oncologist and see what he thinks about this. And unfortunately, I'll tell you, they're probably going to tell you just don't do it because of their lack of knowledge. And a lot of these people don't even know what bioidenticals are. And once again, I'm not here to slam oncologists, but this is just not their field. It'd be the same thing if someone came to me with a type of cancer. I wouldn't know how to treat a cancer. I'd say see an oncologist. That's what they specialize in. But when it comes to hormones, I'm going to default back to you need to see someone who has some type of specialty training in hormone therapy like we do at Buckeye. So, when you were feeling bad, you went to your oncologist, and
Yes.
how'd that go?
Good. There was really nothing that was done. I did go through depression, so I was prescribed several different medications, but I couldn't get myself to take it. So I was left just depressed. I didn't know what to do.
And the depression was brought on from the hormone, lack of hormones.
Yeah, it wasn't just over like a period of time. It was a crash, like a sudden, everything was stripped from me. Mm-hmm. And it's like I woke up one day and suddenly was, busting out in these sweats at least a couple times an hour. And then the depression, so the only thing that they prescribed was, medicine or depression medicine, and then maybe some over-the-counter vitamins for it, but nothing seemed to help.
Mm-hmm. So then, I know we did blood work inside. You were ahormonal. You really didn't have a lot of testosterone, estrogen, or progesterone, and that's why you were feeling the way you were feeling. When you went back to your oncologist and approached them and asked, what their thought process on this was, how'd that go?
Of course, they didn't like it. They weren't sure. They just didn't know. And so I had to produce quite a bit of documentation and research and to explain to them and kind of walk them. And I was almost educating them as well. So when I'm now working with the oncologist, she knows exactly what I'm doing, and I do from your office, get my blood work done. I get my blood work done there for my oncologist, so we're all on the same page, and they're very aware of it. Are they 100% on board? No, but at the same time, I have taken this into my own hands as well to be vigilant on my side and to educate myself, because this is my body, and I know that the way I feel for sure is totally different, and I didn't have to accept what was going on. And I think that really is the case when it comes down to, sitting in the waiting room and these patients look over at me and say, I didn't know I could do that. And they're suffering because I know I went through it.
Right.
And you don't have to.
Yeah, I think you said a key thing there is take your health into your own hands. I could think I had 2 patients come in yesterday, two males come into the office yesterday. It's a little off topic, but not really. And these guys had listened to the show several times, and they're like, I knew I had low testosterone, so I went to my doctor. My doctor kind of, both 2 guys on the same day. My doctor, but the same thing. My doctor kind of scoffed and said, "You're too young. You can't have low T. You must just have depression." So these both guys, different doctors. These guys don't know each other. Were both put on Wellbutrin for depression when they really just had low T. It made no sense. So we did blood work on them, and the levels came back really low on both these guys. I know these guys one guy was 29, the other guy was 35. So, the key thing you said there is you have to take your health into your own hands. And one of the beauties of the internet these days, or you can go to our website, there's lots of good research out there that shows that hormone replacement therapy is very safe and very effective when done properly. So just because your doctor says you shouldn't do it or it's not good for you, do your own homework, because unfortunately a lot of doctors, I just see the trend. If they don't understand something, they say just don't do it, it's not good. And that's not the case. There's lots of good things out there, whether it's hormone replacement therapy, stem cell therapy, ozone, intra-articular ozone injections. This stuff all works. And just because your doctor doesn't understand, he says don't do it, do your own research. Because this stuff is, I see miracles every day at Buckeye. People that have gone down the traditional medical route and have gotten no results, and we're actually able to change their lives.
Absolutely.
So, so maybe the best thing we'll get out of this whole conversation today is, just because your doctor says no, doesn't mean that's the right choice for you. And it's your health. You got to make the right decision. We'd love to help you at Buckeye. It's real simple. You can come to our office. There's no charge for your first visit to see if we can help you. And not everyone's going to be hormone depleted, but if you have the symptoms, why not look? And most insurance covers that first blood work anyway, so come in and see it. And we'll talk one more time about, what are the signs of hormone imbalance. And I want to get age out of your head. So because if you're in your 30s and you're thinking, well, there's no way I can have hormone issues when I'm in my 30s, that's not the case. People even in their 20s can have hormone imbalances. If you're a female and you're having, hot flashes, night sweats, PMS, weight gain, mood swings, insomnia, depression, fatigue, low libido, dryness or foggy memory, these are all signs that you can have hormone deficiencies. And strongly recommend get those checked out. And when you get your regular blood work at your doctor, they're not checking your hormones. So you need to go to someone who specializes in hormones like we do at Buckeye and get a full hormone panel and see what's going on. And if you're a male listening, what are the signs? It has nothing to do with age. Muscle loss, weight gain, fatigue, sleep issues. Men get hot flashes too, and night sweats. Lower libido, irritability, depression, hair loss, erectile issues, memory loss. These are all signs of hormone deficiencies in males. So if you're a male listening to this and you're having these signs, get in your car. We have 5 locations. Come get checked out, or check out our website with buckeyepmr.com. Get an appointment, come in, and we'll test you out. And if that's not an issue and you have these issues, we'll figure out what it is. But you don't have to live the way you're living. If you're listening, suffering, come in and get checked out for sure. So, what advice do you have for women, Laura?
I think that is that they don't have to live with that and think that this is an acceptable thing, almost like a rite of passage. Like, oh, I'm in my 40s or 50s and now I have to go through all these hot flashes. You don't have to do it. I'm glad I found out, and it didn't, it only took me a couple years to get through all of this. But for the women that go through it, you don't have to be in misery like this at all. And it's totally changed my life. I feel like I'm back to normal, back to myself again. And I have that to thank, for sure. 100%.
Awesome. Well, thanks for sharing your story with us.
Thank you.
This is Dr. Buzz with Buckeye Physical Medicine Rehab. Check out our website, which is buckeyepmr.com. And until next week.